Hello, everyone. My name is Jordan Davis. Today, I'll be discussing and talking about the growing problem of drug and alcohol use in small towns, also considered as rural areas. Most people think of cities like big cities, for example, Birmingham, when it comes to substance abuse. I just wanted to look beyond that. So I focused on Michigan, especially Huron County in Michigan, where drug use and overdose deaths have gotten much worse. People in rural places often feel alone, and also it creates barriers as well because of limited resources, such as no access to treatment, also them being afraid of being judged by others often makes it harder for them to get the help that they need. A worsening crisis with substance abuse in rural areas. Drugs and alcohol problems are getting worse in many parts of the United States, but they're hitting small towns even harder. In Huron County, Michigan, overdose deaths went from 150 between the year 2023 and the year 24. That was kind of big, especially since the rest of the county actually saw overdose deaths go down by 34% in the same time. Michigan was a good area to look at because many of the rural counties and communities are far from health services, so they're not able to get those services that they need all the time. There are also a lot of stigmas when it comes to people in substance abuse. People feel ashamed and scared to talk about their addiction or ask for help when it comes to their addiction. Also, one of the most powerful drugs that it seems like more people are on nowadays is fentanyl because it's more easier to find, which makes things even more dangerous. Focusing more on the system of the ecological theory system. To understand this better, I used the ecological system theory. It's a way to look at all the different parts of a person's life that affects their behavior. There are 5 levels to that. And those 5 levels are friends, who might make drugs seem like it's a normal thing. Family, where addiction may run through different generations or stress is high. School, which may not teach enough about addiction. And doctors, who may be far away because you're in a rural county and are not trained to treat substance abuse. These are close relationships that have a big effect on whether someone gets the necessary help that they need or stay stuck in their situation. Interactions between macro system, the I mean the mesosystem. The mesosystem is how these close systems interact. In rural counties, school, clinics, and families often don't work well together. For example, a student might go to school with no counselor, and their parent may not talk to the teachers about their struggles. On top of that, stigma keeps family from going to church, groups, or support meetings, even if help is available. So, environmental factors. The exosystem includes things that affects in a person's even if they're not directly involved. Some examples may include job loss and poverty, which raises stress and increased drug risk because they're trying to cope with the fact that they're not working anymore. No local rehab centers, which means people must travel far away to get the treatment that they need, and they might not have the means to travel. Bad roads or no buses. By being in a rural area, they might don't have those resources in place like public transportation, which makes it harder for them to have that transportation to go get the assistance that they need. Not enough police or healthcare workers to handle the growing opiate problem. All of these are coming places. All of these are coming in rural places, especially in Harris County. Some social influences that may affect this problem. The macro system is about the more bigger picture of things like culture and law. The rural areas, many people value privacy and being heard, which is being self-resilient. But the benefits can stop people from asking for help. And also that goes back to stigma. People are afraid of being judged in the minute that they have a problem. They can be hard for some people. State and national laws also play a big role in deciding what programs get funded now. And we also know with everything going on right now, funding is a big problem, which also is a barrier all the way around. And where clinics can't open is also another thing. Changing over time. In the past, people in rural areas used meth and prescription pills, and now more are dying from fentanyl. Economic changes like closed factories and fewer framing jobs also makes life harder, leading someone to turn to drugs. The good news is new laws and tools like telehealth, so they're getting help online, which is still a form of help, which is good, but we need more in-person help. But they're starting to make treatment more available for the people who cannot get the treatment that you'll be able to get in more of an urban setting. Some programs in more of a macro and meso level interventions. Some programs are helping at the personal and local level. You have some programs out. Two of those programs that are in Harris County is Peer 360 Recovery Alliances. In Michigan, offers support groups and teaches people different life skills and different things to help them with their substance abuse. It's also a life-saving overdose medication called Narlux. I might be saying it wrong, but they also provide that medication for them. Also, family-based prevention programs in the school are helping kids and parents learn how to avoid and stop the drug use as well. These are just some of the steps that are going in the right direction in that particular rural county. Now, from my experience, I do want to share that by me working in rural counties here in Alabama, there aren't a lot of help, but there's more help here in Alabama in the rural counties than there are in other rural counties within the United States. So that's why I stepped out and reached into a different state besides where we live. And also, just to wrap it up a little bit, some of the suggestions and conclusions that we can do is we can start trying to see where we can make a difference on a larger scale. We're starting to see changes in public awareness campaigning. They're also starting to see changes with federal grant programming. The federal grant program are actually making sure that every state has funding to build better treatment opportunities for the rural counties. And I have seen from, like I said, my personal experience, that there are more they're building more resources in certain counties. Agencies like Health Resources and Services Administrations are focused on rural rural suggestions so rural towns aren't left behind. These efforts help create stronger support systems. And in conclusion, I will say that we need to locate more support groups for our clients. Also, better law and funding. Make sure that it's less stigma on the substance abuse name and more education for the healthcare assistants, so we can work together and understanding the full picture, so we can start reducing addiction and saving lives in these rural communities. Thank you all for listening. I hope y'all enjoyed my video.